So I am with Tim Ma, and we are very happy to be here because we will give you all the highlights from breast cancer treatment and what will happen tomorrow, actually tonight, tomorrow, and after tomorrow, the few days. And we will tell you what we can do to improve cancer care. So Tim, thank you very much for being here today.
Thank you, always a pleasure.
So Tim, you checked the program, the abstract. What will change our practice? What are we expecting? What we need to listen?
I mean, I'll caveat this. I mean, obviously, this is the first day of San Antonio. I think you just got off the plane today. We haven't had any actual data coming out yet, but the program looks really, really exciting starting at 5:30 tonight. There were a few themes, I think, that kind of came out when I was checking it out. Not only in medical oncology, although medical oncology is what I know and love, but my fellow radiation oncologists and surgical friends also have very interesting data coming out at San Antonio. I think the theme that we really see in radiation and in surgery is perhaps less is more. In radiation oncology, I see a lot of trying to emitting radiation, whether it's axillary radiation after neoadjuvant chemotherapy, whether it's emitting radiation at all in a very select good risk population. So those abstracts will be coming out on December 7th, if I'm not mistaken. And then on the surgical side, it's always all in the axilla. So can we try to minimize axillary interventions, whether it's going from axillary dissection to targeted axillary dissection to lymph node dissection to nothing. And again, there are going to be several abstracts mainly presented tonight actually, and a bit on December 7th as well. And so that's definitely to kind of keep up with. In medical oncology, I mean...
So just a minute, so we want to avoid the over-treatment. We don't want to over-treat patients because of the side effects, if I understand.
I think we all have kind of gotten to get very familiar with not only the short-term side effects, but really the long-term side effects of all these local interventions that we do. And I think the movement has been over the past few years to try to select out those patients, a bit like chemo.
Yeah.
Who can we omit doing these kind of interventions with, you know, potential long-term side effects? But it's all in the patient selection, and I think we're still trying to like tease it out.
To find the right population.
Exactly, and I think, you know, hopefully we'll get more answers this year in San Antonio. But moving forward, medical oncology, which is kind of what we know. There's both very interesting abstracts in the neoadjuvant setting, adjuvant setting, as well as in the metastatic. I'm going to mention rapidly here, for instance, Natalie, because it's just been such a big theme this year. Natalie the update will be finally presented on Friday, so stay tuned. I will also like to highlight that we do have a very strong Quebec presence at San Antonio 2023 this year. Of note, our colleague and friend, Dr. Lemieux, will be presenting our Quebec registry on metastatic breast cancer as an oral presentation tomorrow, and hopefully we'll be able to get her sitting here and to talk to us about her wonderful work.
Thank you, Tim. So stay tuned and hope to give you all the updates every day. Thank you very much for being with us.
Thank you.